Hello, everyone, and welcome to Athlete Insight. Today, we have a very exciting interview with Dr. Baabak Mostoufi, who is a physical therapist at Emory Healthcare. So, I'm very excited to show you what tips and advice he has for us, along with just a little bit about his career. So, he additionally graduated from the University of Miami with a doctorate in physical therapy, and he has a certification in dry needling, and he's a certified sports and conditioning specialist. He also has an interest in sports, especially tennis, so his perspective and advice today will be really helpful and interesting. So, without further ado, I'm very excited to share this interview with you guys. So first off, can you just tell me, a bit about your background and how you became a physical therapist?
Yeah, no. I am a physical therapist. I work in an outpatient orthopedic setting. I went to the University of Georgia, and growing up, I always had an interest in sports, especially football. That was one of the main sports I wanted to get into. I always wanted to be a part of it. Whenever I got into undergrad, I always thought I wanted to go to medical school, but after taking some classes, I kind of figured out, what are some other avenues that I could be involved in sports? And talking to different mentors, I was introduced to physical therapy and I did a couple of rotations and I just absolutely loved it. And since then, I just kind of went down that pathway. And here I am, went to the University of Miami for PT school. And after that, I picked up a job at Emory and now I work as an ortho physical therapist over there.
Oh, that's really cool. So I also know that you play tennis with my dad, and you also deal with a lot of athletes in your career. So what are some common injuries you've seen with them, and how do you typically address them?
So it depends kind of the age population that we're working with. And I do see quite a bit of tennis players. And typically the younger age, let's go say under 18, most common thing you want to kind of worry about, especially with rotation sports and extension sports such as like tennis, baseball, gymnastics. We see a lot of back injuries, and it can be like a spondylolisthesis or like a pars defect. So anytime I kind of see someone around that age range, we think about that, and that's just basically a bone stress injury. Then a lot of times we see people that have hip or labral injuries as well, with all the twisting and turning that can go with sports. Other sport, as the age goes up and up, like myself, I kind of had a couple of shoulder injuries, so I had to rehab that. And as we get older, we kind of get those shoulder injuries, just general wear and tear overall. So those are some things for specifically tennis that I would be thinking about. We've had a couple of Achilles injuries and Achilles strains as well. So those are something to do. So it's always important to do a warm up program just to make sure those muscles don't get too much of a load right away and you properly warm them up.
Right. So what are some are there any specific techniques you can use to help injured athletes recover?
And one thing that kind of goes back into what the injury is, right? So there
Yeah.
is a warm up program that we usually go through where it's jogging back and forth, doing high knees, doing circles, lunging and twisting the body just to warm up different aspects of the body overall. Now, that will help reduce risk of injury, but unfortunately, we can't say that this is going to prevent any sort of injury. Main thing is, once again, depending on the age population, what are some things we want to look at? So the younger people, it's just looking at, okay, what is the load that is being placed upon them? Are they having back injuries? When is it usually? Most people feel it during serving. So, okay, pick serves puts you at an increased risk overall. How can we change the mechanics of doing that? And we have a very good athletic trainer that does on-court assessments and tries to look at that. We have a physician that does on-court assessments as well that looks at this information. Then, depending on, okay, if it was Achilles injury, load management. What are some things that we can work on? If it's a hip injury, is it because you're hitting open stance versus closed stance? How do you adjust those mechanics? What's your follow through? Another thing that happens too is as we get older, we sometimes shift from a two-handed backhand to a one-handed backhand, and that can sometimes put extra stress on the elbow. And when that puts extra stress on the elbow, we see injuries like that as well. So working on strengthening exercises and stretching out. So just taking into account the individual person, what are their mechanics, what are their techniques, and what are they at risk for, and how we can try to adjust that.
Right. So what are some specific measures that athletes they themselves can take to minimize the risk of injury?
What do you mean by measures?
So like maybe like some conditioning, stretching, like anything they can do just themselves without any like professional.
So kind of was talking about there's a little warm-up program that you can do running back and forth from the alley to alley. That's one thing to kind of just get the blood flowing to start out. Then doing butt kicks to try to get the quads working, doing Frankensteins to get the hamstrings working, doing knee to chest, getting on your tiptoes to work on some stretching the glutes and working on the calf as well. Doing lunges or the side to side lunges just to try to get the groin working. Even adding some lunges with some rotation inside of it just to try to
Yeah.
get that back warmed up. Me, myself, I have bands and I use the bands to try to warm up my shoulder just because, like I said, I've had a couple of shoulder problems beforehand, or even tying it up to a post and just working on speed and repetition just to get ready for that serving motion. And the most important thing is warming up, warming up. Someone like yourself, I bet you can just go out there and just go play and have no problems really. And I used to be like that, but as I've gotten a little bit older, I've realized like, okay, if I don't warm up, I just feel stiff, more likely to strain something, and it just doesn't work out. So best thing is getting some sort of movement overall and doing a proper warm up program. Probably about 15 to 30 minutes worth of a warm up to really get the blood flowing would be beneficial for young athletes.
So I know you just mentioned many, stretching techniques, warming up techniques. So just how important are those in preventing this injury? Is there anything that's like more important or
I wouldn't say there's necessarily one thing more important than the other thing. Most important is just that you're moving and just trying to stimulate the
yeah.
blood flow. So especially for the one thing I would say too, especially as we get older, there's less and less blood flow that goes to the Achilles. And when there's less blood flow over there, we're at an increased risk of having some sort of Achilles tear over there. Now, so that's why it's always important to do some sort of like light jogging, working on the calf strengthening as well, so you can help stimulate blood flow over there to help decrease that risk. I've seen a couple
Yeah.
of people who have unfortunately had like ACL injuries coming onto the cord, and those are some most of the time non-contact injuries. So it's still very important to work on the glutes to try to work on strengthening and just working on proprioceptive drills, which is kind of like your balance and doing different balance exercises to accustom the body into different positions so it's decreased risk of injury at that point.
So do you have any advice you can give to, coaches or trainers to help them support the injured athletes?
And to help support them is one thing I would kind of say is depending on the injury, being patient with how the athlete is recovering. I know a lot of times when we see even parents too being like, oh, when can they get back? When can they get back? They play the 5 tournaments in the next 5 weeks. They need to get ready for this. They need to get ready for that. And although they're trying to be very supportive and helping out, sometimes there is no right answer. It's just depending on how the athlete is recovering. And especially with the younger athletes, sometimes we would like to put in perspective that the professional athletes have a constant care team going over them, treatment, massage, exercises, electrical stimulation year round. They're getting all the care that they can possibly get to help recover from injuries. So trying to put yourself to those standards sometimes is not as realistic because unfortunately, where we are right now, most people don't have the luxury of doing that. So it's going to take a little bit more time and just listening to the athlete, kind of seeing what their symptoms are and helping that grow back. If it's a stress injury, decreasing the time of how much they're practicing, decreasing the amount of rotation that they're doing. For instance, I was talking about the kick serves and serving. Maybe you cut that out. If it's an
Yeah.
Achilles injury, starting closer distances so they're not running back and forth. If it's a hip injury, already work on different kinds of ground strokes opposed to making it an unpredictable setting. So trying to make it a little bit more predictable to get used to certain patterns and then making it unpredictable.
Yeah. So once athletes are recovered, I know many of them are kind of scared of a re-injury. They also almost become paranoid. So how do you
Mm.
help them, regain the strength and confidence after overcoming an injury?
That's a very tricky question, actually.
Mhm.
And there's a lot of research that's going on about different scores and outcome measures that test the psychological readiness of an athlete overall. And the best way to kind of do that is one, once again, the athlete themselves, right? They have to be ready and they have to be mentally prepared because if they're not mentally prepared, they're not going to be playing their best and they're going to be afraid. And that could sometimes hinder your performance and at the same time can cause you to potentially hurt something else. So one thing we like to incorporate in our clinic and why we also have them go to our athletic trainer and do the on-court assessments is to gain their confidence back up. So the idea is, okay, let's start with like a 30-minute session of, okay, let's have you moving side to side as if you're trying to get a ball on the baseline. Alrighty, let's work on some volleying mechanics. Let's go work on some ground strokes if it's an arm injury, see how it feels. Working on overhead motion if you're saying my shoulder hurts whenever I'm doing an overhead or a serve. Just trying to get them used to that position. Once they're used to that position, then we add a little bit more speed of trying to throw something, trying to follow through with something, trying to have them resist against a person going against them just to try to get that speed of contraction and see how they feel in different portions of that range of motion. Hopefully, as they feel more comfortable and the more repetitions they get and they are able to get on the court and move side to side, work on controlled drills, that confidence gets better and better. And
Yeah.
so that's really the best thing we can do, exposing them to the things that they will be worried about. And hopefully, as they get more exposed to it, they get used to it and they feel less uh, fear doing these activities.
So you just mentioned that athletes, to recover, I mean, after recovery, they have to be, mentally prepared and mentally strong. So is there anything specific that you can help with to like help them stay mentally strong and prepared?
Unfortunately, I don't think there's one specific thing that, hey, if you do this, you're going to be mentally prepared and mentally strong in that environment. But kind of like I was brushing up upon a little bit beforehand, like trying to get them involved in those sport movements. So we have like those blaze pods. So let's go say it's a cutting injury. We have those blaze
Yeah.
pods where we have different lights on the floor and they go at random. Hey, you need to go as quick as you can, going side to side, touching different components. That would be something that we
Yeah.
would do a little bit towards the end stages of rehab, but something to mimic a sport specific movement. If it was a younger athlete that had a back injury, which we've had a couple, it's like, hey, I'm afraid of how much rotation I can do. We just hammer home on all the rotation as much as we can, just so to be like, look, you're doing these with medicine balls. You're doing these with weighted balls. You're doing this on your own, trying to get as much force as you can. Hopefully, this will encourage them, whatever the movement that they're more concerned about, the more we do it, then they feel more confident in that.
Right. And then finally, can you share any personal stories where, athletes you've dealt with overcame an injury to help?
Yeah, no. So we've had a lot of different kinds of athletes that come in to our clinic. Like I said, we've had uh, shoulder injuries where it's like, look, I can't serve like the way that I used to. Every time I get to the top portion, I have a pinching feeling overall. We've had a couple of athletes come into our clinic as well, and they have hip injuries, especially the turning component of it. It goes, okay, they had some pinching going on over there. So working on their strength, advising them, hey, this will get better or it should get better. These are the exercises we need to work on. And once they're feeling a little bit less painful, having them try to work on sport specific movement on our side. So we had this one person who they're in the juniors right now, and they had a hip problem. And our physician, like I said, he's really big into the tennis world in general. It's like, hey, do you mind looking at this patient? Squeeze them in. Let's go see what we can do. So we were able to get them in, and they're talking about how, like, yeah, I can't really hit my ground strokes that well. Anytime I reach for a ball and land on my leg, it really bothers it. Well,
Yeah.
looking at them, they definitely had some stiffness in that joint. They also had some weakness in that joint and was like, okay, here's what we're going to practice. And we did probably about 2 weeks worth of sessions of just trying to really target home. And they came about a couple of times in those 2 weeks, probably like two, three times a week. And we really hammered home on trying to get the mobility back in that hip and working on muscle activation exercises to wake up that hip. After that, we started to work on some sport specific movement of reaching, twisting, running after a ball, picking it up, throwing it back with me within the clinic. And once that felt pretty good, they went on the court with athletic trainer, and he gave them different kinds of balls and to see how willing they were to move and how it felt. And fortunately enough, they were very appreciative of it. They got better and they were able to participate in their tournaments without any problems. And
All right.
hopefully no future problems.
Yeah. So that about sums up my questions for today. So thank you so much for, taking the time out to do this interview. And the
Of
information you
course.
gave will be really helpful, not just for me, but for other athletes. So thank you
Yeah,
so
of
much.
course, of course. Thank you for the time, and I hope it helps out.
Of course.